This video presents examination of the peripheral vascular system, including the arteries, veins, and lymph nodes in the arms and legs. In this video, the examiner will assess a healthy patient. Keep in mind that other patients may have the same normal findings or may exhibit normal variations or abnormal findings. Begin by inspecting both arms from the fingertips to the shoulders.
And turn them over.
Note areas of edema, discoloration, rashes, scars, and changes in skin texture. None are seen here. Also note hair distribution and venous patterns. Assess the skin temperature of the hands and lower arms with the sensitive backs of your fingers, comparing both sides. If you detect unusual coolness or temperature differences, check further up the arms. Next, palpate the radial pulses and compare their amplitudes. If you suspect arterial insufficiency in an arm or hand, feel for the ulnar pulse. The pulse of a normal ulnar artery may not be palpable. To help determine the patency of the ulnar artery, perform the Allen test. Place your thumbs lightly over the radial and ulnar arteries and tell the patient to clench his fist tightly. Then firmly compress both arteries between your thumbs and fingers.
Open your hand.
Have the patient open and relax his hand. Note the color of his palms and fingers, which should be pale. Then release the pressure over the ulnar artery. If the artery is patent, the palm should turn pink in 3 to 5 seconds.
I'd like to repeat this test to check the other artery. Will you make a fist again, please?
To assess the patency of the radial artery when indicated,
open your hand.
Repeat these steps, but release the pressure over the radial artery. Next, assess the brachial pulse. Flex the patient's elbow slightly. Then, with the thumb of your opposite hand, palpate the pulse at the antecubital crease, just medial to the biceps tendon. Then try to feel the epitrochlear node. With the patient's elbow somewhat flexed and the forearms supported by your hand, feel in the groove between the biceps and triceps muscles about 3 centimeters above the medial epicondyle. If the epitrochlear node is palpable, note its size, consistency, and tenderness. Repeat on the other arm. To examine the legs, the patient should be lying down and draped so that the genitalia are covered, but the legs are fully exposed. Inspect both legs from the groin to the toes, noting symmetry in size, shape, and color. Also, note areas of swelling, discoloration, rashes, scars, ulcers, and abnormal venous patterns. On the lower legs, feet, and toes, observe the color and texture of the skin and nail beds and the distribution of hair. Next, assess the skin temperature of the feet and lower legs with the backs of your fingers. If you notice unusual coolness or temperature differences, check further up the legs. Next, palpate the femoral pulse by placing your fingers midway between the anterior superior iliac spine and the symphysis pubis and pressing deeply below the inguinal ligament. Just medial to the femoral pulse, palpate for tenderness of the femoral vein. Then, palpate the superficial inguinal nodes, including the vertical group and horizontal group. Note the size, consistency, discreteness, and tenderness of any palpable nodes. Small, mobile, non-tender inguinal nodes are often palpable in normal adults. Examine the opposite inguinal area in the same way. If the patient is very obese, you may need to place one hand on top of the other, like this, to facilitate examination of the femoral pulse and inguinal area.
I'd like to check the pulses in your knees now.
To examine the popliteal pulse, slightly flex the patient's knee. Press the fingertips of both hands deeply into the popliteal fossa, slightly lateral to the midline. The popliteal pulse is frequently more difficult to find than other pulses because it is deeper and more diffuse. Compare this pulse with the popliteal pulse on the other side. If the popliteal pulse is difficult to find, try this approach. With the patient prone, flex his knee to 90 degrees. Let his lower leg relax against your shoulder or upper arm and press your thumbs deeply into the popliteal fossa. Next, assess the dorsalis pedis pulse by palpating the dorsum of the foot just lateral to the extensor tendon of the big toe. If you cannot feel a pulse, move laterally. The dorsalis pedis pulse may be congenitally absent. Check the posterior tibial pulse by curving your fingers behind and slightly below the medial malleolus of the ankle. Then feel for both of these pulses on the other foot. Now check for edema. Comparing one foot and ankle with the other, note their relative size and the prominence of veins, tendons, and bones. To detect pitting edema, press firmly with your thumbs for at least 5 seconds over the dorsum of the feet, behind the medial malleoli, and over the shins. Note any indentation caused by your thumb pressure. Normally, as seen here, there is no pitting edema. Next, palpate the calf muscles by compressing them against the tibia.
Do you feel any tenderness?
No.
Note any tenderness, increased firmness, or tension of the muscles that might suggest deep venous thrombosis.
I'd like to perform a test to look at the circulation in your legs. I'm now going to raise your legs.
If pain on walking or diminished pulses suggest arterial insufficiency, look for postural color changes. Elevate and support both legs to a position about 60 degrees above the examination table.
It'll be just a little bit longer.
Wait 30 to 60 seconds until the feet are drained of venous blood. Mild pallor of the elevated feet is normal, but watch for unusual pallor. Then ask the patient to sit up with his legs dangling. Comparing both feet, note how long it takes for the skin to return to its usual color, normally about 10 seconds, and for the veins of the feet and ankles to fill, usually about 15 seconds. If pinking cannot be seen, use venous filling instead. In lighter-skinned patients, pinking of the skin is easily seen. Rubor, or dusky redness, which may appear gradually in dependent feet, suggests poor arterial circulation.
Please stand.
To complete the examination, ask the patient to stand. Then inspect the saphenous system for varicosities. Here is one small varicosity.
Please turn.
And another.
Do you have any tenderness?
No.
Look for redness or discoloration and feel for tenderness and cords.
Turn.
Note the smaller venous enlargements behind the knees. Examination of the peripheral vascular system involves assessment of the arteries, veins, and lymph nodes in the arms and legs.